Hi, everyone. Welcome back to our third session on mental health. I hope you all were able to journal on our last journal prompt, which was on self worth. And I'm really excited to get into this conversation today. So, I want to start off by defining the cancer care continuum. There's a lot of mixed research on what is included in the cancer care continuum, but I think it's important to outline it so we can understand some of the challenges that may be experienced throughout this continuum. So, the first phase is pre diagnosis, then diagnosis, post diagnosis, pre treatment, treatment, and post treatment. So, anywhere along that continuum, a survivor can experience various challenges, such as psychological distress, questioning of meaning and spirituality, decreased social participation, and a deterioration of meaningful relationships. And that's just a few of the challenges that may be experienced. There could be many, many more. So, some of the commonly experienced emotions include feeling overwhelmed or out of control, a fear and worry about the past, present, and future, stress and anxiety regarding treatment, support, finances, anger, sadness and depression. You are grieving the loss of your health and life as you once knew it, as well as this anticipatory grief about what is to come and what you may be missing out on. There's this immense feeling of loneliness due to either increased support or people not understanding exactly what you're going through. There's a guilt that comes along with a cancer diagnosis, as well as hope and gratitude, which can be very difficult emotions to have when diagnosed with cancer. But there's this hope for this future and a gratitude that it was caught and we're moving forward with a treatment option. So, what is occupational therapy's role in supporting a cancer survivor's mental health? So, we can assist in the development of healthy daily routines and habits that can help to promote our mental health. We can also collaborate on strategies to reduce anxiety and stress by understanding a survivor's motivation, what their concerns are, and what we can do to implement those strategies into our daily routines. And lastly, we can promote optimal participation in meaningful activities by understanding the influence of various factors on one's mental health and physical well being. So, those all are some of the things OT can do, but there's so much more that OT can do on an individual level once there is a referral made to an OT. So there's a lot of different ways that we can support our mental health independently. So this could be participating in physical activity, like we have mentioned and are going to continue to mention throughout Living Life in Review. Physical activity, even just walking, is very important for reducing fatigue, reducing pain, giving us a sense of independence, and allowing us to get outside or get out of our environment and participate in something that helps to promote and support our mental health. We can also join social groups, so finding support groups in your community, maybe through your church, whatever avenue you want to go to explore that option. Meditation, so focusing on a word, object, and our breathing. There are so many resources available that can take you through guided meditation. There's guided imagery, which is a type of relaxation technique focused on creating an image in your mind, an image that brings you peace, and you can walk through that as well. There's also mindfulness, so returning your mind to the present moment, being mindful in the moment, and allowing yourself to heal in that moment. So that takes us into our journal prompt for mental health. For this journal prompt, you're going to be reflecting on the impact of your diagnosis on your mental health. How has your diagnosis impacted your participation in meaningful activities? Have you had to stop participating in certain activities that previously brought you joy? So go ahead and begin journaling on this prompt, and I will see you back for our next session on senses. I hope you all have a wonderful day.